a major new development in the fight against COVID. We are one step closer to a COVID vaccine for kids under 6 years old. Moderna is asking the FDA for a so-called emergency use authorization for their 2-dose COVID-19 vaccine. It would be available for kids as young as 6 months of age and up to 6 years of age. COVID cases among kids under 17 in general on the rise, up 43% from just 2 weeks ago. We spoke to one mother from Iowa who drove across state lines to enroll her kids in Moderna's vaccine trial, and they were under 5 at the time.
As parents, why would we want to leave them unprotected from, COVID? The virus that can cause long-term health effects. After all, it's our job as parents to teach them and to protect them.
CBS News medical contributor Dr. David Agus joins us now for more on all this. Dr. Agus, good morning to you. A lot of parents are very anxious and excited to get this vaccine for their younger children. How soon could it be available, and how effective might it be?
So, Tony, this is a vaccine, 28 days apart, 2 shots, about a quarter the dose that we see in adults. And what it did was it protected from symptomatic infection anywhere from kind of mid-30s to high 40s or 50% in these children. What we know about these vaccines, though, is that what they're really good at is protecting against serious illness. And the immune studies, that is the antibodies seen in this study, were similar to older kids. And so we think that there will be that protection. It's being submitted to the FDA now. They've committed to convening an advisory group in the next several weeks. So I really think by the end of the month, next month, we could have this vaccine out for young kids. And at the same time, Pfizer soon will submit their 3-shot vaccine data.
So, Dr. Agus, what's interesting, we heard from a mother there from Iowa who's very excited for her kids to get the vaccine, but about 2/3 of parents who can vaccinate their middle-aged kids, 6 to 12, have not yet, suggesting some hesitancy. What would you say to that group, and then also parents of even younger kids, about why this is necessary in your view?
So in February, the CDC came out with data that 75% of kids in the United States has been exposed to COVID already. So first of all, it means 25% haven't. But even if you've been exposed to COVID as a child, or your child has, they are susceptible to the new variants. And what we know is that there are hundreds of hospitalizations over the last several months in these kids, and long COVID can happen in significantly more children. So I am a believer that you need to get the vaccine to get enough immunity to protect yourself against these, especially as the virus continues to change. We're seeing new variants pop up. Now we have BA.2.1.2.1.2.1. All of these new variants are certainly more infectious and causing problems. So protect the children, please. Give them the ability so they're not going to get seriously ill or have long COVID.
You said high 30s to 50% efficacy. Doesn't seem very high, though, David.
Yeah, so, initially we got kind of low. With the original vaccines, it was in the 90s to prevent symptomatic infection. And then the virus started to change and those numbers went down. But with the immune bridging studies, that is the antibody studies, I do think we're going to get pretty significant protection or complete protection against serious disease. And that's what really matters. If your child gets mildly ill for a couple of days, not a big deal. If they get serious COVID or long COVID, big deal. And so I think the vaccines will do excellent in terms of protecting against that.
David, before you go, let me ask you about something that Dr. Fauci recently said. He said that the U.S. is out of the pandemic phase. Then he seemed to sort of clarify that statement, saying we're more in a controlled phase, but the pandemic isn't over. So in your professional opinion, where are we in this pandemic, or are we still in a pandemic?
My professional opinion, it sounds kind of scary here.
Yes, very important.
What I do believe... What I do believe is we are now in a position where we can live with the virus rather than hide from it. We have Paxlovid, a treatment for people who have serious medical issues. A good portion of the country is vaccinated or been exposed to COVID. So with enough immunity, even in areas of the country now we're seeing increase in numbers of cases, which there are many. They're not increasing hospitalizations and deaths. So we are learning to live with the virus because of all the hard work that America has put in and because what science has come through. This is a new phase in the pandemic.
Yeah, a lot of big events coming. Dr. Fauci said the other day he's not going to attend the big White House press correspondence dinner. He said clearly for it's in his own level of comfortability is how he phrased it. So for people who are going to these big events, and there are a lot coming up, what's your take on that?
Given Gayle, we have talked about this, you and I, many, many times.
Because you know I'm a very nervous Nelly.
Unfortunately.
Yeah. There's no right answer.
And I love you for that. It is your level of personal risk. And so there is going to be some risk to going to these events. But again, Gayle, you are vaccinated, you are boosted, and if you do get infected, we do have Paxlovid as a backdrop, and it clearly works. And so with that, we can live with the virus. It is a new era.
Okay, I wasn't asking for me. I was asking for a friend. And I am double boosted, David Agus.
David's like, I'll see you there.
Yeah, I'll see you there. Thank you, David.
It is a new era, Dr. David Agus. Thank you very much. To end on.